Hi, my name is Dustin and I'm one of the primary therapists here at All Points North Lodge. And I'm here to talk to you a little bit about different levels of care. Most people come into treatment thinking it's a 30-day program. I'm going to come in, I'm going to acquire the tools I need, and I'm going to leave treatment and I'm going to be all set. That would be great if that's how it actually worked, but unfortunately that's not how it worked. We're dealing with mental health and co-occurring disorders that are very complex and require different levels of care. Try to imagine landing a plane rather than crashing a plane. That's what levels of care look like. Once a client has reached medical stability, then they can actually be transferred up to the lodge where I'm sitting right now. Once you reach campus, we will develop a treatment plan. You'll help write that with a person like myself or another primary therapist to identify specific goals and potential outcomes for you. Once at the lodge, a person will probably continue to be at RTC level of care for a couple weeks or so while they're still being medically monitored by our medical team up here. And they'll be taking medications and probably reducing medications or finding different combinations to address any symptoms or co-occurring disorders that they may be experiencing, including anxiety or depression or something like that. Another important element of RTC level of care is learning how to engage in treatment. What is the structure of treatment? How do I get the most out of treatment? There is sometimes a sense of urgency of like, I just want to get going and I just want to get after treatment. And that'll come, and that's important, and it's important to have that energy, but it's also important to just kind of take care of yourself and identify the goals that you have for yourself. After RTC level of care, when a person has basically cleared the withdrawal symptom period of time, we enter PHP level of care, which is partial hospitalization programming. This has an increase in clinical hours that are expected by insurance companies, and the logic there is a person is now medically stabilized, so they have the ability to learn more and acquire more skills. One question that comes up is, how do I get from RTC or residential level of care to PHP, or can I accelerate that? There's not much an individual can do to accelerate their medical stability along with their coping skills in order to justify a step down to PHP. When a person is ready for step down and they demonstrate medical stability and also have the ability to regulate emotions, we'll absolutely step them down. However, until that time, there's not really a way to accelerate it. It's just working with the medical team, working with the clinical team, and practicing self-care. PHP levels of care can range anywhere from 30 to 40 days. During that time is when we really focus on underlying issues, things that we want to focus on for aftercare planning, different types of behaviors or family systems that may have contributed to co-occurring disorders or mental health conditions, as well as substance use disorder. One of the benefits of PHP level of care is that you have the ability to leave campus. This is something that's really pretty cool and a unique element to APN in that you can get out and explore the Vail Valley. There's different adventures that you can go on. You can go whitewater rafting, you can go skiing, you can go snowboarding, you can go hiking, you can go horseback riding. And these are all very important things to be able to engage in, because a lot of what we do here is actually a modality referred to as experiential therapy, which is a modality in which a person just goes and does whatever activity they enjoy, and unconscious behaviors are brought to the conscious. So we can start to explore that in a clinical setting while still having a good time out in the Colorado Rockies. We can also help you develop your aftercare plan. Aftercare planning is actually a very important element to treatment. And I don't think it necessarily gets enough attention. However, at APN, we put a lot of emphasis on it. Aftercare is, what do I do when I get home? What do I do when I've left treatment? What do I do when I don't have all my peers from my process group around? What do I do when I don't have a clinician available? How do I reintegrate into my family system? What do I do at work? What do I tell people when I get back from being gone for 30, 60, 90 days, however long it ends up being? And we can help sort that out. We know best practices. We have a case management team. So those are the levels of care that are offered at APN on campus. And now I'm going to turn it over to my colleague, Lisa, to tell you a little bit more about the telehealth services.
Hi, my name is Lisa Araka. I am the Clinical Director for Telehealth at All Points North Lodge. Our Telehealth program offers TIOP and TOP services. TIOP is our Telehealth IOP program. It is a 10-hour week commitment, which includes 3 3-hour groups and 1 hour of individual therapy. You are welcome to add on services like telepsych if you're inside Colorado, family therapy if it's appropriate while you're in TIOP, but TIOP is that base of 10 hours a week. A lower level of care, which would be kind of a step down from TIOP, which would be TOP, telehealth outpatient. Typically, it is 1 individual session and 1 OP group a week. You can add family therapy onto that and telepsych services if you are in Colorado. So we have a lot of clients right now that are doing full continuum of care, which means they're starting at the lodge and then they're dropping down to PHP, and then they're moving into TIOP for a period of anywhere from 8 to 12 weeks. And then when they go into TOP, they are feeling like they may need a little bit more support than just 1 individual session a week. And so we can really customize our OP program to meet the needs of all of our clients.
As a team, we're in constant contact with one another. So when a person is at residential in Denver, we're constantly talking to them and being updated on the client's progress, so that when the client gets to campus up here at the lodge, we're aware of what's going on and we can jump right in. Once a client transitions from PHP to telehealth or TIOP, we're in constant contact with the telehealth team, and they're well aware of the progress you've made since you've been on campus, your aftercare plan, and how to best integrate into your schedule. So the big elephant in the room that a lot of people are reluctant to speak about is fear of relapse. And the reality of this disease is people do relapse. But we do know, and we have data to support, the best outcomes come from continuum of care, which is why telehealth services become so important. I wish there was a quick fix to addiction and co-occurring disorders and mental health, but in fact there isn't. We have the data, we have the research, we know that there is no such thing as a quick fix, which is why it's so important to keep up with the continuum of care. This isn't a 30-day fix or a 60-day or 90-day or even a 6-month fix. This is adopting a new lifestyle and a new philosophy, and APN's here to support you the whole way.